I think the way to go is to collaborate with medical oncology and especially at the moment immuno-oncology. One of the most exciting new developments is checkpoint blockade and immunotherapy. It's one of the biggest breakthroughs in cancer care for the last decade.
So we're starting to see a big impact on survival, which I think is incredible. We're actually becoming part of the frontline therapy for patients in multiple different types of disease states.
I think this is a really exciting time for interventional oncology. We see the space expanding. If we look at HCC, SIRT, or radioembolization, used to be the treatment of choice in a palliative setting. Now we see patients being treated much earlier, and that's reflected also in the BCLC, the Barcelona guidelines that were published last year.
Combining systemic treatment with interventional oncological procedure, and I believe it is the future, one of the largest future for interventional oncology.
So what we think the future will be the combination of the therapies we have involved to get a synergistic effect, that all stakeholders of the tumor board will work together for the best supportive care. And what we think intra-arterial therapies and interventional radiology will take a really big place in the future of interventional oncology.
So the next development is probably in the practice standardization. Taking into consideration the maturity of many interventional oncology techniques, I think that this is the right time for practice standardization and to develop new standards of quality.
What we have already seen in this conference is the combination between cryoablation and immunotherapy. There have been many talks about that. I think that will be the future. In the next couple of years, we will see more and more experience, studies, and we will see collaboration between all kinds of expertise of the interventional oncology.
I think about expanding indications and giving more patients access to these treatments. One example could be with TheraSphere, where today most treatments are in the liver, but we're starting early stage trials in prostate, also in brain cancer and recurrent brain cancer. So, looking at different ways that TheraSphere might be able to add value for our customers and for patients.
The focus of IceCure is to have cryoablation for breast cancer treatment available across the globe. This is the main theme for us. We have just shared our interim result of the ICE3 study, cryoablation for early stage breast cancer. We have promising results, less than 2% of recurrence in about 200 patients across the US.
Here in Europe, we're specifically invested in the ablation field, where we have two very important highlights that I want to share. One of them is the CMAR registry, which is a long-term prospective registry that is all across Europe, and it's focused on patient outcomes. We also have a very important study called the Collision Trial, which is focused on colorectal liver metastases, comparing thermal ablation versus surgery, and with the objective to show non-inferiority of thermal ablation.
Gabriel will focus in the future on more precise treatment to maximize the tumor effect and to minimize any non-target effects in delivery of the treatment.
For SurSphere's Y90 resin microspheres, we've only scratched the surface. It's about research, expanding into other indications, looking at other cancer types, different organs where this therapy might have an applicable resource to support the patients who need to be treated.